Good afternoon, and welcome again to all members of the press who happen to be on the line, and thank you again for taking the time to listen to this briefing by the Pan American Health Organization on the current Influenza A H1N1 outbreak that we're experiencing. Let's start by summarizing the epidemiologic situation. Globally, we know today the latest data show 22 countries reporting some 1,400 cases of confirmed influenza A H1N1 virus. There have been 30 deaths reported, 29 of those from Mexico and 1 from the United States of America. In our region of the Americas, we now have some 1,373 cases being reported from Canada, Colombia, Costa Rica, El Salvador, Mexico, and the United States, and as of today, Guatemala. Again, the numbers will rise and drop. We know as of today that Mexico has more than 11,000 suspect cases under investigation. We need to stay focused on those activities related to preparation and prevention. Yesterday, I emphasized the following points are important for individuals to understand to protect themselves and their families. I would like to repeat those points. I happen to teach Masters of Public Health students down the street at George Washington University, and I find a little repetition is actually quite good and oftentimes very much appreciated. So those points I'd like to repeat briefly are the following. All flu outbreaks are serious. This one is especially serious because it's a new virus. This means people have not been exposed to this infection and therefore have no immunity. The incubation period of this disease probably ranges between 2 to 5 days based on the seasonal influenza data we have, as well as data coming from the current outbreak. The period of communicability, that is when an individual is infectious, ranges from the 1 day prior to any symptoms being felt by the person to 5 days after. The method of transmission is by droplets. So again, we want to highlight the importance of hand washing, personal hygiene, covering the mouth when coughing, using disposable tissues, and social distancing. The clinical features remain unchanged. This is a disease that appears mild to moderate, and the southern hemisphere is about to enter its winter season, and the winter season provides better conditions for more rapid influenza virus transmission. So let's review some of the burning issues that have come to us today. First, over the last few days, we've actually received hundreds of questions about the phases of the pandemic and how that relates to the severity of the disease. Let me start by saying there is no connection. The phases refer to the geographic spread of the disease, not the severity of the disease. I think it would be prudent for us to briefly review the definitions that WHO uses for defining the phases of a pandemic. And for purposes of this discussion, I'll lump the first 3 phases because they're behind us. And I just want to say that within these 3 phases, really what we're dealing with is infections among animals, and we're only dealing with a few infections among humans. Moving to phase 4 requires the documentation of sustained human-to-human transmission. Phase 5, which we're currently in, would be sustained human-to-human spread in a community of 2 or more countries in one region of the world, and that's what we have with the United States and Mexico in our region of the Americas. Phase 6 meets all those criteria of phase 5 with the addition of sustained human-to-human disease spread in a community in at least one other country of another region of WHO. Subsequently, after phase 6, WHO uses 2 additional definitions, post-peak and post-pandemic. Post-peak phase is when the transmission is clearly diminishing. However, I should say that there is always the possibility of recurrent events. The other definition is post-pandemic, when disease activity has diminished to the level seen in the regular influenza seasons. Phase 6 is a declaration of a global pandemic, and again is not an indication of severity of disease. While Phase 5 requires countries to activate their emergency plans, Phase 6 requires them to actually implement them. In our region, most countries are already implementing their emergency plans, even before any official announcement of Phase 6, if it were to come. And indeed, this is good because we're in the heart or the eye of the storm. The term Phase 6 is more relevant for the rest of the world than it is for us because, as I said, we're already implementing our emergency plans. For us here in the Americas, we are not certain about how the risk assessment of H1N1 virus will evolve. But we know its management will likely be a long-term challenge, whether we move to Phase 6 or not. Another issue that we're dealing with is how to interpret and either confirm or dispel reports that we receive so that we know when we're having discussions like this, we are sharing the most accurate information with you, the press, and also the public. Since the crisis began, we currently detect dozens of reports each day from various sources, including the press. For many of these reports, we need to follow up on them and investigate them so we know what we're dealing with. You can imagine how much time and effort this must take, but when necessary, it has to be done. As we have said that there should be no travel restrictions or closure of borders, we would also like to emphasize that countries around the world should be fair with individuals. It is not helpful to blame or stigmatize people who happen to be citizens of infected countries or happen to be victims of this disease. Dr. Mirta Rosas, the director of the Pan American Health Organization, asked me to walk you through what the possible scenario would be, what happens to a sick individual who seeks care in our country's primary health care systems. Fortunately, in most communities, we have the health infrastructure in place for individuals to seek care at their nearest health center or hospital. We know in Mexico, in communities that have less developed levels of care, mobile teams have been organized to look for cases, obtain blood specimens, and when appropriate, treat the patient with antivirals if indicated. These mobile teams have been organized by the Ministry of Health of Mexico to cover large geographic areas every day. In communities where health centers are more accessible, including Mexico and other countries, a provider screens the patient and determines whether the presentation of the patient's signs and symptoms warrants a blood test for influenza A. An appropriate treatment is provided at the point of patient contact as well. Depending upon the patient's or the hospital or the clinic, let me be clear, but depending upon the hospital or clinic's capacity, the blood specimen or the nasal pharyngeal swab obtained is tested there or sent to a more centralized reference laboratory for determining if the patient is infected with influenza A. If so, the patient is classified as a probable case using the standard case definitions. The specimen that tested positive for influenza A is then sent to even a more specialized lab to determine if the influenza A is actually caused by the H1N1 strain that we're currently encountering. In that situation, the case is confirmed as a positive case with the disease caused by this new influenza A H1N1 virus. The investigation leading to probable and then confirmed case designation for a particular patient is also a signal for the implementation of a cascade of other public health activities. The patient's history is important to determine in order to understand where and when the patient most likely acquired the infection. This also helps us determine which people have been exposed to the virus. Contacts of the cases are investigated, and in the public health service circles, this is called contact investigation. Early outbreak, in the early phases of the outbreak, these contact investigations are important in order to control the spread of the virus. But as the outbreak gets larger and becomes more widespread, it becomes more difficult to investigate all these contacts, perhaps hundreds, thousands, and even millions of potential contacts. These investigations require a sophisticated laboratory network, a large and extensive team of field staff to conduct the investigations and collect specimens, public health experts, epidemiologists, and virologists working in the labs. Contacts that test positive require follow-up. This means going back to the community and trying to find and notify the contact of their test results and also provide the necessary treatment if appropriate. Aside from the rather extensive network of human resources required, this work also requires an enormous volume of reagents and laboratory supplies. I hope you can begin to imagine the huge volume of effort that all this work entails. In addition, the specimens found to be positive for H1N1, to the extent possible, the virus is studied in more detail. For example, the genetic sequence is determined to see over time if there have been mutations occurring, and if they are occurring, at what frequency, at what place on the genome, and what are the implications. So this is a highly sophisticated process that the CDC, in collaboration with PAHO, is doing to help the Mexican authorities. This also explains why the mobilization of experts from PAHO's regional and country offices and from partners in the Public Health Canada and in the U.S. Health and Human Resources Centers for Disease Control and Prevention to the outbreak was absolutely critical. I would like to end by again reminding people that with the Southern Hemisphere entering its winter flu season, there is a strong likelihood that there will be an upsurge of cases in your countries. Implementing your pandemic emergency plans is very, very important. Most countries are already protecting their populations as we speak with seasonal vaccination activities. In addition, most, if not all countries, have enhanced and accelerated their surveillance and monitoring activities. The challenge will be then not to drop your guard. We've never had such close surveillance of an emergence of a new virus like the one we're experiencing with Influenza A H1N1. And so we're learning as we go along. And finally, to say again that the top priority for the Pan American Health Organization is to ensure fair and equitable access to the distribution of resources such as the antiviral medications and vaccines. So let me stop there and entertain any questions that you may have. Thanks again for taking the time to listen to this briefing.
Thank you very much, Dr. Andrus. With today's technology, we have a multitude of sources for questions. So we have people on the phone, we have people by email, and we may have some people in the room. Are there any people in the room that want to ask any questions first? And if not, we'll go to the phones. Harry? Okay, if not, ponme la... Okay, while we wait for those calls to go through, let me pass you, John, a question from Doris Gomorra de El Universal México, who asks in Spanish, after laboratories get the new vaccine, I'm wondering if PAHO has any kind of information about the distribution of vaccine against A H1N1 around the world, and if Mexico would be one of the first countries to receive it. And with next month's winter starting in the southern hemisphere, she would like to know if PAHO is working with Latin American governments to reduce the spread of this new virus, especially in the southern hemisphere and Mexico during the cold months coming up.
Estos son preguntas excelentes. Estamos trabajando con nuestra fondo rotatorio, que es el mecanismo de la Organización Panamericana de Salud, a comprar vacunas para los países. Tenemos más de 30 años usando este mecanismo. Tenemos un equipo de la organización en administración y compra de vacunas. Ellos están trabajando cada día negociando precios asequibles para los países. Entonces, con la experiencia, creo que la oportunidad a garantizar un suministro de vacuna para nuestros países es muy, muy bien. Hay desafíos, empezar de que yo dije, hay desafíos. Sabemos con el nivel de ciencia, el nivel de la capacidad de los previadores, con todo igual a igual, probablemente podemos producir no más de 1 o 2 billones de vacunas, 1 to 2 billion dosis de vacunas. Y no es suficiente a vacunar cada persona en el mundo. Y por eso va a estar muy, muy importante entender los riesgos de la gente para esta enfermedad que puede dirigir dónde debemos vacunar, quién debemos vacunar con estos riesgos. Estamos trabajando con todos los países, incluyendo México, en el contexto de este brote global.
Our next question comes from Ben Case with Interpress. Please proceed with your question.
Hi, how are you?
Fine, thank you.
Good, thanks. I guess my question's about what information do we have now about the first case or the first few cases, human cases of this virus, and maybe how it may have started.
First cases of how it started.
We've actually received this question quite frequently, and that's data in the field. And to be quite honest, we're focused here on what we need to do today, so we're not spending a lot of time with that, and really focused on looking at the influenza season coming up for the Southern Hemisphere and ensuring that we're doing everything we can to help our countries, including the current situation in Mexico. So I have personally not spent a lot of time investigating that question. There may be other colleagues, but that's how I'll leave it.
Okay, thanks, Dr. Andrus. Now we have a question from El Salvador, in which Nelly Castillo asks, ¿cómo se controla o cómo se controlaría que la cuarentena se cumpla en el caso de que haya un sospechoso?
Um, Cuarentena en español. Cuarentena. Es un término que está usando en salud pública para identificar personas en riesgo para desarrollar una infección serio. Pero no es posible determinar en este momento con este riesgo de exposure si la persona va a desarrollar la enfermedad. Entonces, el uso de cuarentena es a poner esta persona en una habitación aislado sin conexión con su familia o otros para prevenir la posibilidad a transmitir infección si esta persona lo tiene, pero no sabemos. Entonces, en algunas situaciones, esta acción es muy agresivo, es obvio, pero en algunas situaciones depende en las condiciones locales, los datos, la severidad de enfermedad, es una intervención bien para controlar transmisión. Pero cuando hay un brote grande donde el virus está en cada lugar, cada esquina de país, probablemente no es útil. Thank you all.